Hi, everyone. This is Dr. Karen Scott. I'm president of the Foundation for Opioid Response Efforts. I'm really thrilled to welcome all of you to our webinar this afternoon. We are happy to have an opportunity to provide an information session and talk a little bit more about the request for proposals, which we released in late May. Just for those of you who don't know as much about the foundation, I'll just take a couple minutes and introduce FORE. But just to go over some of what I see are some questions in the chat already. The webinar is being recorded and will be posted on our website, which is noted on this slide. Shortly after the session ends, we will also post the slides that we're going through this afternoon. This session is mostly about trying to answer some of your questions, so please feel free to begin to enter those questions as we go along. And please use the Q&A button found at the bottom of your Zoom screen to do that. If you see a question already entered that's similar to yours, you can use the upvote mechanism to prioritize that question. We will try to get to as many questions as we can during this session. And we will also develop an FAQ document after the webinar to document the questions and answers that we've gone through in this session and get through some more of the questions that we don't have time for this afternoon. If there are any suggestions for us, we're always very happy to hear and to learn. There will be a brief survey right after the webinar, and I'd really appreciate it if everyone takes a couple extra minutes, give us some feedback on whether this format is helpful to all of you as you consider applying to submitting an application to our RFP. So, we can go on. So again, for those of you who are new to our audience, welcome. Again, the Foundation for Opioid Response Efforts is a fairly new foundation. We were launched late in 2018 as a private national grant-making foundation focused on supporting the opioid crisis. The focus of the foundation is to inspire and accelerate action to end the opioid crisis by supporting and convening partners to advance patient-centered, evidence-based solutions. We think about our work through a number of different pillars, including professional education, supporting payer and provider strategies, supporting developing policy initiatives, and supporting work to increase public awareness around solutions. We are also developing the foundation's work across three complementary activities. So grant making, and obviously and largely using requests for proposals is the way to develop a portfolio of different grants. We actually have a total of 43 grants that we've awarded since we launched the foundation, but also doing a lot of work in terms of convenings, including webinars on different topics, webinars with our grantees, and beginning to develop an increasing number of resources by partnering with our grantees and other experts in the field, including issue briefs and policy briefs. I'm going to turn it over now to my senior program officer, Dr. Ken Shatchkis, and Ken's going to walk you all through some of the specifics of this RFP, what we're thinking, what we're looking for, and then we will open it up to your questions. Ken.
Great, thanks, Karen. Thanks everyone for joining today. We thought this webinar information session would be really helpful based on the amount of questions and the high interest in the RFP that we've been receiving over the last couple of weeks since we've released it. So let's dive in and let's go over some of what we are. So the purpose of the Opioid Crisis Innovation Challenge and what this was born out of, essentially, I'm sure everybody knows here that a lot of effort, resources, and federal and state funding has gone to address the opioid crisis that has been occurring for a number of decades at this And we continue, even with all of that effort, we really are faced with a crisis that may be worse now than ever after the COVID-19 pandemic. And one of the reasons, besides the pandemic, that we may be in this situation is because there still are these really long-standing challenges that we really haven't developed great solutions for yet. A lot of attention given to solutions that have been presented in years past, and specifically around the issues, the topics that we'll go over in a little bit, and what this RFP is looking at. What the pandemic has also been able to show is how innovation can come out of bringing together expertise from many different fields, different sectors, bringing academia, healthcare, technology companies, government, all to the table to really solve complex and immediate problems. And for example, during the pandemic, once we were all staying at home, it was only days until we had systems set up in place that was monitoring the pandemic at different levels of data, at different levels from the state to national to international. And can we harness that similar cross-sector collaboration that we saw during the pandemic and utilize that momentum to really bring that over and accelerate new improvements, innovation, solutions for the opioid crisis across everything that we think needs to be done around prevention, treatment, and long-term recovery. So that's kind of the framing of this RFP. So the funding opportunity here, again, to really utilize the momentum of the pandemic, and we would like to provide grant support for specific projects that bring a new innovative approach to these longstanding complex issues that has really kept us from really addressing and stemming the tide of the nation's opioid crisis.
Ken? Yep. We lost your volume for a moment.
Can you hear me now?
Yeah.
Great. Okay. So let's move now into the funding opportunity for the target projects, which is where we get a lot of questions as to what these categories actually mean. So what we are looking for are projects that are really novel and use new, quote unquote, outside the box ideas to bring new approaches into the field from other fields and engage, quote, multidisciplinary cross-sector teams. And when we say multidisciplinary cross-sector teams, we're not just talking about within a sector. So not just healthcare teams working with another healthcare team or another academic team. We're really talking about how do we start to bring different industry, whether it's an industry organization, whether it's legal organizations, technological organizations, solutions from other fields, bring them to the table, bring them together with our healthcare teams and teams that have been working on the opioid crisis for a while to really begin to solve some of these very, very complex problems. And based on conversations in the field with experts in the field over the past several months through program advisory meetings and scientific advisory council meetings here at FORE, we identified three areas of focus that we believe that this bringing new innovative approaches can really begin to solve some of these problems. So the first is around professional education and training. And I do see already that there's a number of questions in the Q&A box around what does that actually mean. So yes, the professional education and training, we made this broad to really send the signal that this is not just about educating healthcare professionals. This is about educating professionals across all industries and anyone that's going to be interacting or addressing opioid use, patients with opioid use disorder. So I see in the Q&A someone asking whether it's legal professionals, technological professionals, criminal justice professionals. Yes, we're talking about the whole gamut here across. And this, again, really is focused on the idea of stigma being so prevalent in our society right now and really needing to find new solutions to address that so we can move forward and help people. The second category, which we've heard quite a lot about, is around data. and specifically timely and actionable data. Now, we go back to COVID-19 pandemic and how we've been able to address that crisis based on real-time data that was developed, that systems were developed immediately. With the opioid crisis, while we are getting better at getting data, we're still often lagging behind what real-time, what is happening in real time. And we essentially then are developing policy, building new solutions, and responding to the crisis based on data that is old and may not be necessarily relevant at that time. So the question that we want to know is, how can we again use what we see in COVID-19, the pandemic, and responding to really begin to develop and integrate new and untapped data sources across, again, different sectors to generate a much more in-depth, real-time understanding of the opioid crisis. And this includes applying these new emerging technologies that we're seeing in the technological field, machine learning, artificial intelligence, advanced algorithms to really help national, state, and local government responses to the crisis. The last one is around, and we intentionally were vague here as a way to see what the field thinks about this, is around supporting the transition from treatment to recovery. We get a lot of questions here as to what necessarily is considered that transition. And I think that the major point we want to make here is that transitions from the point where you are in treatment and going to get medications every week at your clinic to when you are ready to go into long-term recovery and start to build those other parts of your life so that you are in a stable recovery, those are vulnerable points in someone's treatment plan. So these transitions, and how can we use new technologies? How can we develop innovative ways to support those that are moving from that every day, every week, really intensive care to recovery? So now, again, with everything that we do here at the foundation, we are always incorporating a focus on patient-centered solutions and on health equity. All of our RFPs to date also, and really everything that we do is very focused on really helping vulnerable populations specifically. And again, as Karen said at the beginning of this, the foundation is really built on a framework of meeting these overarching objectives that were established at the beginning of the foundation around professional education, payer and provider strategies, policy initiatives, and public awareness. So the award amount that we are have for this RFP, we are able to award up to $300,000 a year for up to 2 years for these projects. Now, that doesn't mean that everyone needs to apply for $300,000 a year and for a total of 2 years. You can apply for less time and for less money, but obviously the amount being requested needs to align with the scope of work of the project itself. So we'd ask you to be mindful as you develop your ideas and your budgets. The RFP will be open. It opened on May 19th, just a few weeks ago, and will be open until July 19th. And that, to be clear, is the time that you will need to be able to submit your short concept notes for us to review. Eligibility, which is we've been getting a lot of questions about. So generally, FORE, like every other private foundation, or generally most every other private foundation, we consider grant requests for specific charitable purposes from, and you can see the list here. It's generally nonprofit, tax-exempt institutions, government agencies, whether it's state, local, or city, as well as Native American tribal governments. Now we don't, and when we say specific charitable purposes, that is to essentially signal that we do not fund general operating expenses. So everything that we, so when you apply through this RFP, it has to be for a specific project within your organization, not for general operating expenses. You can find more information on eligibility on our website where we detail it out a little bit more. Now the key dates. So as I said, concept notes, which is the first stage of the application process. That's a short structured concept note. You'll see it when you apply through there that there are just, I think there's 5 questions that are listed with word limits. So we ask you to be mindful of those word limits, and we'll be pretty strict about that, considering we do expect to get a lot of applications in. You have until July 19th to submit that concept note. We will then, program staff here, as well as we may reach out to external experts. We will review those concept notes and we will invite a number of them to submit a full proposal. The latest that you would hear for that we request a full proposal would be July 30th. I believe that we're giving about 6 weeks or so to, I believe it's like 6 weeks or so to submit the full proposal. That is where we'll be asking really for a very detailed work plan, where we'll be looking for a deliverable schedule, milestones set by you, full budget, as well as financial documents that will allow us to determine and do due diligence of your organization's financial status. So what we plan to do during that full proposal stage is that this would be a very iterative process. We would work with potential grantees to ask questions, develop proposals, and get to a proposal that we feel is a good match for this RFP. We will have several opportunities throughout the year to present grant recommendations to our board. So we fully expect that there may be 2 groupings for this RFP. Maybe some awarded in October and some more awarded in January. But the latest notification of final decisions for those full proposals will be for February 28th, 2022. That's when you'll know. And you can see the link there down there. I'm sure you all know where we have the application, but there is the link if you need it. So here's our contact information. Again, you can find all this information on our website. We really do ask you to send those general and eligibility inquiries to that info@forefdn.org. We do expect to have a lot of applications and a lot of questions. But again, if you have any questions about the program itself or technical questions, feel free to reach out to either myself or to our program associate. That's it. I think now we wanted to make sure that we left a lot of time for your questions. So with that, we will jump in there.
Great. And we have a lot of questions.
We did already. Yeah.
42 questions. Ken, can you just go over again? There are a couple questions about the concept note itself, to the length and how much we're looking for in terms of the budget.
Yeah. So the concept note. So the concept note must be submitted. All the applications must be submitted through our grants management system. And again, you can find that link on our website at our grants and funding page. The concept note is not an open note per se. It's a very structured note has 5 questions and text boxes where you will answer them, and with word limits in there. So it's generally the questions that we're going to be asking is really, what's the purpose? How is this innovative? How do we, what's it called? What's your plan for sustainability? It's asking some basic questions for us to get a sense of what the project is before we would invite a full proposal.
Right. And for it, in terms of this question about the budget, we're only looking there for a ballpark overall number. We're not looking for any detail on the budget for this, but just give a sense of what you think it would take to do the work you're proposing.
Just the total amount. Yeah, we would just need the total amount and the number of months that you would expect the project to be.
Great. Okay. I'm just going to keep moving down the list. In terms of the time frame, as Ken just laid out, the latest date that we would be approving these grants would be February of 2022. It's likely and hopefully we will be able to take some projects to our board if the proposals are ready in the fall, likely in October. So you could anticipate or work with a time frame of thinking about a project that would either start towards the very end of 2021 or early in 2022. as Ken said, in terms of operating, general operating costs, we do not do. We'd be looking for funds to be used towards a project, a specific project. Certainly staff time that's required to do that project is obviously fine in terms of the budget. Okay, on the three topical areas. So we are looking for projects that fit in at least one of those. If you have an idea that crosses into two of those areas or across those three areas, that's great. We'd be really interested to see it, but we will not be able to consider in this round proposals that do not focus on at least one of these areas. I hope that's clear. Okay.
I think the next one, which is does FORE consider telehealth distance education an acceptable path? Yes, we definitely do. You know, I think that's one of the realities of the pandemic. What it's taught us is that I think distance education, virtual education, is going to become a more commonplace. So again, I think that would be perfectly fine, and would be very interested to see, you know, what new innovations can be brought to that approach.
Right. In terms of allowable costs, again, hopefully the earlier response, we are looking for grant funding that will go towards meeting the objectives of specific projects. We do allow a 10% indirect, so we do not do general operating, but we do, as a foundation, allow for an inclusion of 10% indirect with the full budgets, which again is more than you need in terms of detail for the concept note.
Mm-hmm. Okay. So in terms of the number of awards that we expect to make, so at this moment there's no expectation of any specific number of awards. It's going to be very dependent on you know, what we receive in as through the application process. We did write in the RFP, you know, just considering what I just said, that there's a possibility that that this RFP may be opened up to a second round, depending on what we get in after it closes in July. So at this point, cannot give you a full answer, I guess, that you would want in terms of the number.
Yeah, we don't know what we're going to get, but we'll see from our two prior RFPs that in a cohort of projects, we're between around our recovery RFP, we did 9 projects, and our access to treatment, we did 19. So roughly somewhere in that ballpark. Yeah. Okay, can be on opioids or other drug misuse, or just so we certainly recognize increasingly from the data that this is a polysubstance issue. You know, the funds do need to address opioids, but we are open to projects that would include other drug misuse as well, as long as opioids is a part of that. Ken?
So the next one, in terms of professional education and training, would a concept note focused on training a national network of community-based be competitive? Would students and residents be appropriate beneficiaries? So again, it's a very difficult question to answer because we just don't know what we're getting in. I think that a training program such as that would be very interesting. We hear a lot about the great need to get more training into primary care. So, you know, it'd be interesting to see, but in terms of saying whether it's competitive or not, it just would be very difficult for me to give you an accurate answer at this time.
Yeah. Okay. Again, proposal doesn't have to address all 3 of these areas, but at least needs to be one of them. Yes. And innovation might be training professionals that don't typically get training. Absolutely. That's part of the idea. Is how do we broaden that and hopefully break down some of the usual silos in this work.
Definitely. Next one, target population. only about the use of technology. No, this
No.
is not about that. This is, so what we put here are just examples that we've heard from experts in the field and that have been floated around. But obviously, the innovative solutions that you come up with could go past a lot of this. We really want to see what you all come up with, what's happening in the field. So please just take these as examples and not the limited list of what we would be willing to fund.
Okay. Let's see. Lost my.
It's the top one. Yeah, long-term recovery.
Other questions? Yeah, on recovery is an absence-based concept or more we are very much looking broadly, harm reduction, very inclusive approach in terms of how we think about recovery and including what some of the social determinants are, what some of the other social economic supports are that are needed to help someone maintain a successful recovery.
Yeah, and just to the question, I see that's.
Oh, sorry, I skipped.
No, yeah, it's moving based on people going up and down with it. But on the one before that, we are not suggesting that long-term recovery necessarily begins after medication support is ended. I think the point of that last one is we were intentionally vague because we really want to, again, hear from all of you and your ideas of where are those points that we may be able to help in those transitions, in life transitions for these individuals that are going through care. So again, it may have different definitions depending on what the project is being presented. So, we kept this intentionally vague for that reason.
Right. A preference for funding large national organizations or membership accreditation organizations. If you look at our website, you'll see the diversity of our current 43 grantees. We've got some large national organizations, some associations, academically based projects, and we also have a number of smaller community-based organizations, frontline treatment organizations. So, and that's, I would say, our only preference is to maintain across our overall funding portfolio a really good mix in terms of types of organizations, types of populations that are that those organizations are engaged with, and geographic diversity. We're a small foundation, but we are a national foundation, so we are very much looking at how we extend the reach of work that the foundation supports across the country.
So I'm just going to take this one. So there's a requirement that the program is a new program, or what is the definition of innovative? It doesn't necessarily have to be a new program. It has to be a program. It has to be a solution that hasn't, I guess, necessarily been really either evaluated before or really is widespread and being used. I think the definition of innovative, again, I think that's the case that you will have to make to us. As part of the concept note. The concept note asks for that specifically when you are presenting your strategy as to why is this innovative in the grand scheme of things. So I'll let you all take care of that one.
Yeah. And the only thing I'd add to that is that, it may be taking an existing model or program and and thinking about applying it in a new way. Right. Yeah. So it may not be that all components of it are new or innovative, but if you can look at something that's there and it's worked in one setting and say, well, how would this work with another population and another setting, et cetera, that may also be innovative. Average size of the grants, again, you can get a good sense from our website in terms of some of the range from our earlier RFP, but as Ken described, the funding level will consider budgets up to $300,000 a year for each year for up to 2 years.
Excellent. If persons with OUD are included now, is there a minimum, maximum, or range of persons served you would expect? No, I don't think so. Again, I think it comes down to, the scope of work has the funding amount being requested has to align with the scope of work. So that's the guidance that I can give in terms of the number of persons that are being served.
Great. Okay.
All right.
Let's see, people are being.
I don't think I fully understand that question.
Yeah, in terms of qualities possessed by trainers. I'm sorry, maybe if
Yeah, if you can clarify in there,
clarify or add back in. But,
yeah, right.
Were people living with OUD included in the planning of these project areas and strategies, and if so, what were their recommendations? So as Ken described, the areas that we're focused on for the RFP overall, as well as for these specific areas, really come through a number of different consultations that we do with people in the field, with people who are leading organizations who are in recovery themselves or in treatment or recovery themselves from CUD. As well as from members of our board and our National Scientific Advisory Council. So this is really a compilation of a lot of discussion, research, and bringing all those streams of discussion together.
Mm-hmm. Yeah, and it's definitely not necessarily a comprehensive list of what is necessary, what is needed at this point. This is we decided to focus on these three specific topics for this RFP.
Yeah.
Our submissions from an international team, US Canadian eligible, is project with international focus eligible. So we are mandated to focus on the US opioid crisis, but we would accept submissions from a US institution that has a partner that's international. For example, we do have a grantee with UCLA. That is an international collaborative with many different countries being represented. So in that sense, but the applying organization that the project will be housed must be a U.S. institution.
Chosen back on the logistics, if you're chosen to submit a full proposal, what is the deadline? We will, at the point where we ask for to go from concept letter to a full proposal, if selected, we will give you a 6-week period to submit the full proposal.
It'll be from when we contact you. So with this RFP, someone on MAT is not considered to be in recovery. Someone on MAT could very well still be in recovery. Again, the idea was to be pretty vague about this and see how everyone is defining it in the context of their own projects. So if you again consider someone on MAT as transitioning into recovery, that's perfectly fine.
Yeah, right. Similarly, is it just technologies to support treatment to recovery or other supports? Absolutely, other supports. We don't want to limit this to ideas or innovations that are solely in the technology field. I know we put a couple of those in as examples, but very much open to a whole range of of innovations and how to support people through that journey. Does the proposal need to include use of innovation technology? Again, so if so, can it be coupled with harm reduction treatment recovery services that would be partially or fully funded?
I think if I understand the question correctly, I wouldn't see why not. If you're using an innovative approach to address, these areas, harm reduction, treatment, and recovery services, I believe that would fit in the RFP. We would just have to, I think seeing the concept note would help clarify what you mean by that. So, but based on that, I don't see why not.
Yeah. Right.
It looks like we have some upvoted ones, Karen, that went to the top.
Yeah. Oh, okay. Is it more cross-sectional players a project? Is the more cross-sectional players a project involves, the better? Or to, again, I think it needs to fit the project.
Yeah.
We're obviously looking for some collaboration, some thoughtfulness across bringing more people together rather than staying siloed. But whether it's 2 versus 3, et cetera, should really be driven by what makes the most sense for the work that you are, for the objectives of the project and what you're trying to achieve.
Mm-hmm. At the top now, there's a question about would harm reduction practices and or policy development be allowed? Again, I think it just has, it'd have to fall into those 3 categories that we have. If, it's again, an innovative approach in professional education and harm reduction settings, then it may be considered. Same thing with policy. I think it has to fall into one of these 3 categories and be innovative within that specific field.
Okay, indirect costs I referenced earlier. So again, the foundation allows a 10% indirect cost on
10%
budget.
10% on direct costs. Yeah.
Right. For an expectation of matching funds. There is not. However, we are always open to ideas of co-funding projects with other foundations or with public funders. So if that's something that's an opportunity as part of your project, it's certainly good to flag.
Just keep moving through. Do you anticipate a future RFP that focuses on policy? Don't know how to answer that one right now. I think we.
There will be more RFPs.
There will definitely be more RFPs. We do have several grants that are focused on policy solutions right now. So we'll see what comes out of those. And again, there may be a future RFP that focuses specifically on it.
All right. Having said that, realistically, as a small foundation, it's not likely that we will put out more than 2 large RFPs a year. So, timing wise, I wouldn't look for something, in the next month or so. That would be a little bit further down the line. Again, partly because we do have a number of active policy projects underway right now particularly as part of the access to treatment work. And we're going to want to see a bit more about how those develop to inform the next thing we do.
Definitely. So the next one, can an organization submit more than one concept note? Yes. So an organization may submit more than one concept note, but we're limiting 1 concept note per investigator. So you'll just have to make another concept note and have a new account with the new investigator on it.
Include staff benefits. Again, that's we're getting into more details of the budget, but we do allow staff salary as well as benefits to be counted as part of the staffing budget.
Yeah, include for fringe.
Okay.
What would be the project start date? Well, that's the project start date. I think we'd work with you again when we get to full proposal stage. We would see where proposals are at, how much work they necessarily need to be, and if we get to a point where we would recommend that proposal for funding, then we would work with you on that start date. Ideally, we like to start the projects pretty soon after awarding, so that should give you a little bit of a sense if we're looking at sometime maybe in October, sometime maybe in January to do sets of awards.
Okay, applications versus awardees. We have been pretty gratified by how much interest there has been in the foundation, particularly as given how new we are. So we have gotten very large responses for our first 2 RFPs from late 2019 to through 2020, and that has meant that we have been able to select and fund somewhere between 5 and 10% of what we get in applications.
It obviously just depends on what we get in and the number of applications. But it has been very competitive. We've been very impressed by the quality of the proposals coming in. So really excited to see what everyone comes up with here.
Yeah.
Will proposals be evaluated on a rolling basis? So, again, us here at the foundation and staff, we'll be able to look at some of these, before the deadlines, but we won't be making any decisions, at least the concept note stage, until that July 19th deadline, where we have everything in and we can compare everybody's proposals in. So, so at that stage, it won't be a rolling basis. Again, in the full proposal stage, it may be awarded on a different, again, being October versus January, depending on where the proposals are. But we are going to wait till we receive all the concept notes before making decisions to file full proposals.
Can you talk more about the education track audience for this? So again, one thing to keep in mind in terms of the education piece is that is that a priority topic for us that we're interested in is how do we work with different types of professionals around the issues of stigma. And breaking down the issues of stigma and bias towards patients with OUD and other substance use disorders. So in terms of could the training be for students, again, students if that's with the idea of reaching whether it's health profession students, legal professional students, et cetera, students engaged in learning towards a criminal legal system. All of that would be areas we'd be interested in.
Definitely. Just quickly, again, the length of the concept note. It's a structured concept note, so it's not an open-ended one. There will be word limits in there. So if you just log into the application, into our grants management system, you'll be able to see what those word limits are.
Great. In terms of addressing diversity, for the next question, a proposal that would expand a program that's worked in one area that's not very diverse to an area that is, again, certainly sounds like that would be a good fit. That would be aligned with some of our objectives.
Can you explain the type of work would be allowed under the policy initiatives area? Could it be development or decision maker, education, et cetera? Yes, I believe so. Again, it depends on what you're going to be presenting. It needs to fit, again, one of those three categories. But to get a sense of kind of the policy projects that we have funded, definitely encourage you to go to our website and you can filter it by policy initiatives, projects, and you can get a sense of what we funded in the past.
Just to flag there, again, as a private foundation, if the question's leading to sort of advocacy around a specific piece of legislation or working with or talking with policymakers around legislation, we cannot fund that. So we can, as it's written in the question, certainly support educating policymakers on issues, but not to lobby or advocate for a specific piece of legislation.
Great. Oh, sorry.
Where are we up to now? We are way down to our last.
We actually are hitting our 3:45, which is we're going to end, but I think we can do a few more.
Do a couple more.
Let's do a couple more. We've only done 40 so far, so.
Halfway there. This is terrific. We again really appreciate everybody's interest in this work, and we learn as we do these as well.
Can you talk about the criteria that will be used to evaluate the proposal? So again, the way that we go about evaluating proposals, we have a scientific advisory council. We have a network of experts in the field that review these proposals, as well as staff, and our board is the one that ultimately approves of them. So, again, it comes down to experts that are very well versed in these fields and understanding and scoring these proposals, and then staff determining which ones we would bring to the board for funding.
Yeah, and I would say as we're looking at the concept notes again, encourage everyone to really attend to what's on the slide on the screen, that we're the ones that will rise to the top are ones that where we do see both something that's new, but also but where there's a multidisciplinary approach, or bringing different sectors together, or engaging in a cross-sector manner, and that focuses on a project or work that hits at least one of these 3 target areas.
Mm-hmm. Yes. What reporting does FORE require for grantees during the grant and as a final report? If awarded a grant, in the grant agreement, we're very clear about the requirements, the deliverables of the project. We monitor it through a number of different ways, through check-in calls, through formal progress calls, reports that are asking, to line up your progress with the milestones that you set in your proposal. But we really do view ourselves as partners, and we interact with our grantees much more often than that. So, reporting wise, everything will be in the grant agreement, but our grantees we consider as part of the FORE family, and we work with them really at any time. Great. You want to do one more?
Okay, one more.
Let's do one more. Should we go down to the bottom and just select
Just trying to see what else is. Oh, yes, we've got lots.
Anything that we haven't.
Okay. Is a budget for 300,000. It's up to 300,000 per year for up to 2 years. Yes. We've addressed the advocacy question.
Yes, the budget's 300,000 per year. That's the max allowed. And then, yeah, I think we've covered a lot of it.
Yeah, I think we've covered. Again, if you, we're happy to continue. We hope that this helps a lot. We will put out an FAQ document and try to get to make sure that we've covered the questions here. But equally, if you are running into any challenges, additional questions either about our grants management system, through which everything needs to be submitted, or further questions to clarify a point on the RFP, feel free to get in touch with the team, with Ken or Lydia. What will be more difficult for us to do is respond to everybody, to questions about, about specific ideas. That's why we start with the concept note. We want to have something that's really quite, hopefully very low burden in terms of getting a discussion started, and then we can identify and work with people from there. It would be hard for us to be able to respond to everybody to give guidance on whether or not to submit a concept letter. But again, I hope that the concept letter is an easy enough step that we can get thoughts and discussion going. Ken?
And we will have this, we'll have this information webinar recording on our website after this. So if you have any colleagues that were interested in attending and having some of these questions answered, it'll be available for viewing online. But with that, we're very excited to see the ideas that come out of this, for these specific areas, and really excited to see your proposals come in. So again, please reach out, if you have eligibility questions. But with that, hope everyone has a great day.
Great. Thanks so much for your interest. Bye-bye.